And good evening. Ja-Antillean here with you tonight, this evening, this morning, whatever time it is in your neck of the woods. I'll be having a guest today, and she'll be telling us how to listen to our body. Do not ignore any signs. Sometimes we have headaches, we ignore it. When we go to the doctor, it's not what we are thinking. Our chest hurts, and we think it's maybe gas. We haven't drinking any hot tea. So sometimes we think more or less it's gas when it turns out to be something else. Yes. So it's good for us to pay attention to our body. And the nurse, Dottin, is going to tell us more about not ignoring our bodies. You know, we tend to always ignore our bodies, right? Yes. We tend to always do that. And that is not good for us. As you know, it's not good, period. Because when you go to the doctor, the result we got is not nice. And we don't want to hear a result that is not nice, right? Mm-hmm. We want to hear good results. All right? So let us pay more attention keenly to the warning signs. Sometimes we have a little lump on our hand and we just brush it off and say, sure, that's okay, man. You know? Sometimes we buck our toe and then maybe a week or two, you know, it's swollen, it get infected because we didn't pay attention to it. And we don't want that, right? We don't want that. So we got to learn more about our bodies, right? So anything you feel like it's not right, nobody know your body more than you now. Hey, hello, Horish. Nobody know your body more than you. So we got to pay attention. Anything we find not right with our bodies, we go to the doctor one time because it pays out in the end. Because we don't want to hospitalize. We don't want anything bad to happen. I'm okay. I'm good. It's Sunday and I'm good. We're going to have a guest on the program right now telling us about our bodies. So I'm going to get in touch with her now. Yes, I had a good day today. I stayed home and I rest. I rested well. No, Sister Dottin, you have to talk straight, not video.
No problem.
Not video, sis. Yeah. You're not a.
No problem.
Yeah. Good afternoon, nurse. Good afternoon, Nurse Dottin. How are you today?
I am good, thank you.
How was your day?
What about you?
I'm good. I stayed home today and I rest.
Nice.
I do gardening today. I do some planting some sorrel today.
And, wonderful.
And tomatoes. What about you? You went to work today?
No, I did not went to work today. Today I did some house shows and I was busy with the family.
Yeah, wifely
just
duties.
Getting ready for today.
Wifely duties, right?
That's right. That's right.
Mm-hmm. As always. Okay, yes. So can you introduce yourself to us? You do it better than me for sure.
Don't say that, but I will try my best to do so. So, my name is Alicia Dottin, better known as Nurse Dottin.
Yes.
And I am a nurse for approximately 10 years.
Ooh.
This year will make it 10 years since I'm in the profession.
That's nice.
I currently work at the St. Martin Medical Center. I'm working there for approximately 7 years now.
Wow.
That's a little about me. If you want to know more about my social life, I
No,
am
no,
married.
no, no, no. That's good enough.
No problem.
That's
No
good
problem.
enough, Sister Dottin.
No problem.
Okay, so
Yes.
you're gonna tell us of not ignoring any signs in our bodies, right? That's our topic today. Listening to our bodies.
Correct. That's right. The topic for today is actually early detection, listening to our bodies.
Right.
What's the power of early detection? What are those identifying health issues that we can detect early and that we can take steps to prevent them so that we can live longer and live healthier lives?
Okay.
Yes. That's what we're going to be talking about today.
Interesting topic.
You know?
Interesting.
Indeed. And I ask many persons, if I go to ask you, Sister Paulette, how often do you go for regular health checks? What would you tell me?
I'm on point.
You're on point?
I'm always on point. If my toe hurt me, I go to the doctor. I'm on point. I'm an elder now, so I have to take charge of my body.
Amen. Wonderful. I quite agree. And I tell persons, go have regular health check. It may be more frequent than others. I don't want to specify how often because some people go see the doctor once every 6 months. Sometimes the doctor says see me every 3 months. It all depends on the discretion of your family doctor. Yes.
And the illness.
Some might have to do more frequent than others. But it is important to make regular health checks with your family doctor.
Yeah.
Yes? Because as we know, prevention is better than cure.
You're right.
Yes.
And we don't want to hear sad news, right?
That's it. And today, Sister Paulette, we're going to talk about some of the fears that persons encounter and prevents them from going to get regular checks.
Yep.
Yeah? We're going to talk about what are those fears and how we can mitigate or minimize those fears. But it is important for persons to know the powerful control that they have. You have control, Sister Paulette. I have control over listening to our body. Our body, God made our body and gives us warning signs that we can pay attention to so that we can be able to take that control and go seek medical attention.
And live a little longer. Yes. And live a little longer, right?
That's right. Who don't want to live a little longer? All of us wants to.
Wants to.
That's it. So let's jump right in. What do you say?
Yes, go ahead.
No problem. So when we're talking about early detection, we are talking about identifying health conditions before they show symptoms or become serious. Yeah. So early detection, you want to detect something. It's just, for example, if your fridge is going bad or your stove is going bad, you might get a scent. You might see it start to flicker a bit, the burners, or you might see different symptoms taking place that lets you know that your stove or your fridge has a problem. It's the same thing with our bodies. Identifying health conditions before they show symptoms or become serious. And I'm going to explain to you guys today what are those signs, things that we should be aware of, that we can pay attention to and go to the family doctor to get help. As I said earlier, prevention is better than cure. And the earlier a disease is found, Sister Paulette, the easier it is often to treat.
Yeah, I know.
So the earlier a disease is found, it is easier to treat. And I can mention some things as cancer screening.
Hi, Margaret.
When we go to do our mammograms. When last you did a mammogram, Sister Paulette?
Late last year.
Late last year. Wonderful.
Yes.
Wonderful.
I did that yearly.
That's what?
I did that yearly.
Wonderful. Yeah. So doing our yearly mammograms, and for us, some of us we might have to do the colonoscopies. Yes. Some of us might have to do the pap smears.
I did that too.
Very good. All those things are things that we can do now, so that we can detect. Yep.
Uh-huh.
so that we can detect whether we have cancer, or if not cancer, maybe there's a problem that can be treated at its early stage. And that treatment is more effective than finding it out at a later stage when there's no treatment options. It's just chemotherapy or palliative care, and then you're sentenced to death. Yeah.
I know, I
It's so
know, I
important.
know. Because cancer is very rampant these days, right?
Very, very rampant.
Young,
Very, very rampant.
young and
Mm-hmm.
old, young and old.
Young and old. We have
Yeah.
brain cancer. We have breast cancer. We have a lot of breast cancers going around now. We have
Mm-hmm.
cervical cancer. We have prostate cancer. We have colorectal rectal cancer. All those cancers are raging and plaguing mankind and society today.
Yes, boss.
But thank God we have modern technology, Sister Paulette.
Mm-hmm.
We have modern technology out there that we can do screening. We have prostate screening, we have breast cancer screening, we have cervical cancer screening. All those things are put in place so that we can detect earlier if there's a problem and treat it way before it gets out
It
of
get out of.
control.
But remember,
Yes,
men doesn't like to do that, checking up. Some men, not all
that's
men. Not
right.
my husband. My husband
That's,
always does, but yeah, a lot of men do not like it.
that's true.
And
That is so true. A lot of men do not like it. And maybe in another podcast, we can talk more about the fears and
I have
anxiety
it.
and what are the conceptions out there
Mm-hmm.
about why men don't like to do that test. Yes.
Yes, I know. But you have blood test, you can do
Yes.
PSA. You don't have to do the next one, the rectal one. You can do PSA, right?
The digital rectal exam. You don't have to do that step as yet, but you can always do the PSA, the
PSA.
testing in the blood. That's
Mm,
it.
the PSA is good.
Mm-hmm.
Mm. Hi, Sister
Yes, the
Art.
prostate
Mm-hmm.
specific antigen test. Mm-hmm.
Mm.
Yes. So some of the benefits of early detection, before I go into the warning signs, what are the benefits of early detection? First, we have increased survival rates. So
Mm.
the earlier disease is identified, Sister Paulette, it's earlier we are able to lead to successful treatment and higher survival rates. So,
Yep.
for example, if someone is caught with early stage of breast cancer, let's say, for instance, they go to the doctor, they do a mammogram yearly, and the doctor spots a lump in the breast, or they find stage 1 breast cancer, they can easily schedule a patient to do a mastectomy depending on how far in stage is that cancer, and the
Yeah.
person have a higher chance of surviving for many more years
Mm-hmm.
because of that early detection.
Yep.
Yes.
Mm-hmm.
Mm-hmm. Even improve quality of life. With that early detection, that person can live, as I said, a little longer. You know, things like treating conditions like diabetes or high blood pressure. If someone goes to the doctor regularly, check their blood pressure, and realize, hey, I am hypertensive, I have high blood pressure, and the doctor puts them on medication, that can improve their quality of life. Yes, then they have to be at risk every day for heart attacks and strokes as a result of not checking and not knowing your numbers, as I would say. Yes?
I can see it,
That's
Maggie.
another benefit. Mm-hmm.
Mm-hmm.
And another benefit which all businesses like is cost saving, even for us. Early
Rewrite
detection
it,
often
Maggie.
results in less costly treatments than addressing advanced diseases or conditions. We know chemotherapy and all those advanced medicines are very expensive. So if we could go through the cheaper process of early screening and going through those like the little tests and so mammograms and prostate screening and those things, then we don't have to spend the big bucks when it comes to the surgical procedures and have to go through all kind of radiation and chemotherapy to kill those cancers and so. So it reduces costs when we take control of our health and go out there and get screening.
But one question: the chemotherapy and natural remedy, which one is best, or both?
Well, the thing is, the chemotherapy is good and bad because what happens with the chemotherapy, it kills the good cells and the bad cells.
Mm-hmm.
That's what happens.
Yep.
Yes, so
Mm-hmm.
it's a very aggressive treatment, and
Yes.
that is why it makes persons very sick, and it starts their mental capacity, and so much things goes on. However, with the natural hormone remedies, of course, this one is more on a slower pace. Everybody body responds differently to those
Differently.
natural remedies.
Mm-hmm.
Yes, and it takes a longer span, but it's more tolerable than the chemotherapy and so. But
Mm-hmm.
different prognosis for different people.
Yeah. Because
Yes,
some people took the natural remedy and still live long.
that's true. That's true. And some people they take the chemotherapy and it kills them faster than the natural
Than natural
remedies.
remedies. But my
Mm-hmm.
husband uncle lived for over 15 years with it. And he used to drink
You see?
soursop bark. Every time I travel, I have to bring soursop bark
Yes.
and certain things for him. But he took it with his medication.
That's it.
And
That's it.
yeah, he lived for
And
over.
some people they change their diet, they exercise more. What they were doing before, let's say they were smoking or drinking, they would have cut out all those bad behaviors, those bad habits, and they would have had a longer improved life. Yeah.
Mm-hmm.
Mm-hmm. So it all depends on the individual and their mindset and how aggressive they want to go, and what is suggested by the family doctor as well.
But some of them so addicted they can't get over the addiction, so they still do both.
That's it. That's it too.
So they kill
Mm-hmm.
themselves faster.
That's true. That is true.
Addiction is
Mm-hmm.
something. Addiction, eh?
I'm telling you,
Mm-hmm.
it's a deadly, deadly, deadly um, habit. Mm-hmm.
But you know, sometimes with
So,
us.
Sister Paulette,
Mm,
mm-hmm.
go ahead.
You were saying?
No, you go
No,
ahead.
you were saying?
No, I was telling you.
No, no, no. I
Sometimes you
was
feel some pain in the chest, and you just maybe say it's gas, or because you haven't
right.
drinking any hot tea.
Right. I'm coming to that point in a few, but I just wanted to mention something before I go to the warning signs.
Mm-hmm.
I wanted to talk about why people skip early detection, why people ignore those signs. Before I get to the signs of what we should pay attention to and not ignore, I want us to look at some of the reasons why people ignore those signs. And for one, we've been mentioning it, fear or anxiety. Most people don't want to go and get screening because they are fearful of bad news.
Right.
And you said it earlier when we started.
Yes.
Yes.
Mm-hmm.
Some people say, what I don't know won't kill me.
Right.
People are saying, me, nothing wrong with me. I'm good.
Mm-hmm.
But the minute they go to the doctor and the doctor say, you're sick, you have high blood pressure, it's like anxiety take over, panic attacks, sleepless nights.
Yep.
Yeah.
That happened to me already.
That for me,
Uh-huh.
kills people faster than the actual diagnosis.
Yes, sir.
Literally.
Mm-hmm. When it tells go,
So fear about it is a big factor in preventing persons from just, paying attention to their body or actually just going to get screening.
Yes, sir. Trust me on that one.
Mm-hmm.
I know. I went through that already.
Yep.
Can't sleep
Yep.
until I get the results.
Yep.
So,
A lot of people are fearful. And two, they don't know. They don't have the knowledge. Some people don't know what will be done. They don't know what will happen. So not only fear as to the bad news, but also fear of what will happen. What are the symptoms? What to expect? So that's why I advise patients, I advise clients to read up. Not read too much, because there's a lot of things on the net that can get us scared as well.
oh yes.
But just having a little knowledge of what the procedures are, what questions they will ask me, what to expect, helps reduce some of those fears.
Yep.
Mm-hmm. So fear is our number one factor. Another factor that can prevent persons from early screening too is lack of time. I've noticed on my job, Sister Paulette, that a lot of people want to come to the doctor. There are people who want to come and get checkup, want to come to the general practitioner specialist, but they don't get the time. Some people, they say they're always busy. They're always busy doing everything else,
always busy.
except that's it. But they don't make their health a priority. And what you notice is some jobs don't give persons the time to come to do what they have to do. Some people try to take it during their day off, try to take it during their lunch hour, but then when they have to come to the doctor or wait long before they can get attended to, that discourages them from coming back again.
Yep.
You understand me?
I love her. Yep. That's for sure.
That's it. Some people don't end up staying the line too long, and they get frustrated and say, you know what, I cannot stay here with my job comes first, and they leave and they never come back again. So taking time off to address their health condition, for some people they see it as wasting time or a lack of time. They don't have the time for that, and they don't make their health a priority.
When that happened to me, what I did, if I get a long appointment, I go over on the friend side. And if the friend side is a shorter time, I do it on the friend side. I'm not lingering. When they come onto my health, the money cannot buy the casket, eh?
That's right. Yes. That's right. That's right. And that's why we are here today, stop on it. What you're doing is very good. Because you're making persons aware. Let them know the importance of early screening, early detection, and why it's necessary and what can be done, because our health is priority, and we should really do our best to ensure that, we take care of our health, of what God would have blessed us with. As we know the saying, health is wealth. Health is wealth. If you don't have health, how can you work and provide for your family?
Yes.
Health and strength. And then the one last other reason why persons are frightened of going and get early screening and so is because of finance. Finance is the number one issue again too. Some people don't have health insurance. Some people do not have the option to go to the front side or go to with a cash in your hand to pay. The Dutch side covers SZB, Nagico, and all those things. But
that's true.
So some people don't have the finances. They want to. Some people are undocumented, uninsured, and as a result, they don't have the money to go to the family doctor or to pay to go to the lab test or so. So that's another reason why people don't get detected early, screened early. And when they do finally end up in the hospital, maybe due to some emergency or maybe they collapse or something, then you hear stage 4, then you hear heart attack, then you hear all the worst diagnosis, and then it's harder to really treat them at that stage.
You know what I noticed rampant to strokes? Sister Dottin, yesterday I was by the home in St. John's, and the ambulance came. And the ambulance came there, and I saw this guy. I was shocked out of my. I was so shocked when I saw him. I was numb. I telling you. He had a stroke. I was numb when I saw this guy. I telling you, strapping.
I could imagine.
No.
I could imagine.
Can you imagine?
I
strokes. It's just that thing.
The young and the old.
Yeah. That's why I'm telling you, strokes, cancer, those things, heart attack, these things going. Oh my God, no.
Yep.
I can't come to grip yet. I saw this guy. No, sir.
Yep. And that is why we have to screen, start doing this from now.
Yeah.
When you hear people suffer a stroke, suffer heart attack, sometimes you ask yourself questions, were they following up with the doctor? Of course, there are cases where it goes unnoticed. There are no signs. But most of the time, persons experience signs and they ignore it. And let me talk about some of those signs. Sometimes we have some of the signs that people tend to ignore, Sister Pauline, is chest pain, sudden chest pain, or pressure in the chest.
Yeah.
We like to blame the gas. We like to say, oh, it's gas. Everything we like to say gas pain.
Right.
And me as a health professional, I cringe when I hear people always blame certain pains on gas.
Yeah.
They go drink a cup of hot tea, or you see they try to walk, or you hear they belching, or they burp, or they fart. You understand?
Yeah, guess what they do? They always buy a Coke, and whatever they bring down, send down in their stomach with the Coke is what they bring up back. Remember, they like to take Coke.
That's it. That's it. What they do too.
Yes.
But I'm here to tell the population out there that Not all those symptoms, all those signs are gas related.
Right.
There could be something more serious going on there. And it's important that we pay attention to those signs. So whenever someone talks about having sudden chest pain or pressure in the chest or in the neck or so, that's a call for concern. That's something that you should never ignore. It's best you go to the doctor, seek medical attention immediately, let them rule out all those factors before concluding on your own. It's gas.
Yeah.
Yes.
Always. I don't drink a tea this morning.
Always.
They always say that.
Any
Yes.
abdominal
I'm
pains.
good.
People like to complain of abdominal pains. And we like to say, oh, you know, it's period cramps. We never know. Don't assume. Never assume. It's better to go get checked and find out. People like to complain of severe headaches. Oh, I have a migraine. Oh, I'm accustomed to migraine. Oh, I have headaches for 2, 3, 4 days. That's not normal.
Yeah.
That's not normal. That's not things that we should not ignore. Go get your pressure checked. Go get your vision checked. We never know what is going on. Yeah?
Yeah, because I always go by the doctor in my eyes, right? And I went on the friend side. I went in the States, I did it too. I went and checked my eyes. And they say I have a trace of glaucoma.
Okay.
So that's early detection. Yes. And I always go in doctor here now, and I went on the friend side and they detect it. So my brother and I, yeah, my mother had it. I don't know if it's genetic or what, but my mother had it.
Yes, most likely it's hereditary. It's probably family. It sounds like a family history of that in your family.
Yes, so the pressure have to always use this drug to keep the pressure down.
That's right.
So that's early detection. Yeah.
That's right. And it's a good thing you are paying attention to your body, huh?
That's what I'm telling you. That's what I'm telling you.
Yeah.
Early detection
that's right.
is good.
Even also, another sign too, some persons, they have unexplained weight loss. You're not doing anything to lose weight. You didn't change your diet, but you just notice that you're losing a lot of weight. That's not something to just brag about and say, hey, I'm losing weight. Maybe there's something going on internally that you're not aware of.
Yes.
It could be cancer. It could be so many different factors. So that's another thing that we have to pay attention to. Unexplained weight loss. You're not doing anything to lose weight. You didn't change your diet. You're not exercising. What is causing you to lose weight so rapidly? That's something you need to check as well. Yeah.
And sometimes you see some people on the road and you say, oh, you get so small, but they feel, they feel offended, but then that to show you're losing weight, so check about it, right?
That's it. That should put them to think. Let me consider what this person is saying. Let me go get checked. Let me go on the scale, see what's happening. Let me monitor the figures.
But you could see,
but some people are so sensitive. So sensitive that they take more of the offense than actually alert to check themselves.
But sometimes you felt it in your clothes too.
Yes. Most times you do feel it in your clothes.
You feel it in your clothes. So by that, that could tell them, because when my clothes ain't fitting me, I kind of get a little worried.
I tell you, especially, of course, you have the factors where maybe you don't eat 3 times a day. You're so busy up and down that you don't have time to, eat as you would normally do. But outside of that, you're just losing weight for no reason. That's something for you to pay attention to for sure. That's a sign you should not ignore.
Someone was saying usually that's the thyroid. Somebody online was saying usually that's the thyroid.
Sometimes it can be a thyroid or affected, definitely. Hypothyroidism or hypothyroidism, you have that as well too. So that's why it's important for you to go get checked. Because when you go get checked, then you can identify what is going on. Could be thyroid related, could be diabetes, who knows? Because diabetes as well can cause you to lose weight as well. Could be cancer related, so many factors. But if you don't pay attention to your body and then you don't go check it out, then you won't know.
Then you won't know.
Yeah. Another dangerous sign again to Sister Paulette is shortness of breath.
Yeah.
frequent shortness of breath. You of course they're the ones where you're walking up a flight of stairs, or you're running a marathon, or you're going up some hills. That is different. But you walk, or you're doing a task at home, a simple task at home, or you're walking from a particular flat area from A to B, and you get so short of breath and you're tired so quickly. You have muscle aches, body weakness. That's a call for concern. That's something you should not ignore.
Yeah.
You're talking with someone and you find yourself panting and having to pause to catch a breath. That's not
It's
normal.
not
You need to
normal.
check that out. Yeah, you need to check that out. Yeah,
Mm-hmm.
you always short of breath. You find you're going to do a light task and you notice that you're breathing heavy. That's not normal. That's not signs that you should ignore.
I had that
You have to
once.
seek medical attention.
I had that once, and I run to Dr. Birdboy.
I tell you. Mm-hmm,
I
mm-hmm.
was having a
I
problem. I
tell
run to
you.
Dr. Bird fast.
That's it. That's
Hmm.
it.
I
Mm-hmm.
never hesitate.
And of course, mm-hmm.
And then 1 year after,
Yeah,
she said, "Do it again," and I did it again. Yeah, I run as fast as
wonderful.
possible. I prefer I
Mm-hmm.
prefer live than die. You know.
I tell you, it's
But
so important to listen
but,
to our bodies.
why is it?
There's so much of signs out there. So much of signs. Sometimes, of course, as I said, there are things that go without symptoms. But if we are very good at, being aware of ourselves, knowing who we are, being self-aware, we can detect a lot of things and be
Yeah.
able to, go and check it out. Now, I'm not saying that we should run to the doctor for everything. No, I'm not saying that. You have some people, they're always by the doctor.
Yeah.
Every week,
That's my husband.
twice, two, 3 times a week.
As my husband
You
finger
know?
hurt. That's my husband. When
I tell you,
when I go to do blood test,
no.
when I go to the blood test, my doctor sent me to do a blood test.
Mm-hmm.
I always notice what she sent, what he or she sent me to do. And if I see something what she's supposed to send me to do, I tick it off now.
Right,
I tick it
right.
off. I used to work at the lab.
Exactly.
I used to work at the lab, so I kind of know a little about those things.
Right.
So when I felt my
Mm-hmm.
body and I say this is the test which is sent me to do, or he, I tick it off on it, and then I didn't realize they didn't send me to do certain tests. They didn't
I tell
realize.
you.
Hmm.
Mm-hmm.
Yes, I
It's so
said
important for you to check.
yes. I
But
tick.
of course, we have those people who are on the extreme that will go, as I said, to the doctor for every little thing. That's
Mhm.
not the idea.
That's not the
But at the
idea.
same time, you should be able to go get your checks, your regular checks. Mm-hmm.
But with diabetes, why diabetes damage your system like that? The kidney, I think.
So what happens in diabetes is that we have the different types of diabetes. We have type 1 diabetes,
And
we have
two.
type 2 diabetes, and then we have the gestational diabetes. The type 1 diabetes are those people who are born with this condition. Type 1 diabetics are inherited. They are born with that diagnosis.
Oh,
So these are people who are dependent on insulin for the rest of their life. They are insulin dependent.
wow.
That's where the pancreas don't produce no insulin at all.
Uh-huh.
And with that situation, what happens is they are on life. Once they're living, they have to take insulin for the rest of their life because the pancreas has a problem. It's not able to produce no insulin. So whatever food they eat, whatever carbohydrates, protein, fats, when it's broken down by the body, there is no insulin in there. The pancreas doesn't produce no insulin. Or even if the pancreas do produce insulin, it's a little bit and it's not enough to break down the glucose in the body. So as a result, those people who are type 1 diabetes, they are insulin dependent. That's it's not anything to do with them eating or lifestyle issues, but it's just how they were born. In a
Oh,
sense, they were inherited with genetics, and as a result of that, it is type 1. But type 2 diabetes, now which is the diabetes you're talking about, it's more caused due to diet and lifestyle issues. So in type 2 diabetes, what happens is that the pancreas produces either little insulin or it doesn't produce enough. The body does not recognize the insulin. So what happens is that the pancreas would make the insulin, or there is a damage in the cells of the pancreas. So there is a particular cell in the pancreas that is responsible for releasing the insulin from the pancreas. So the insulin is produced by the pancreas. The pancreas is located in our body, and what happens is upon it is that the cells that are responsible for releasing the insulin in our pancreas is damaged in the person who is type 2 diabetes. And as a result now, the body has a hard time being able to control the blood sugar levels in the body due to those factors. Due to the fact that the cells are broken in the pancreas and the insulin is not being able to be released. And if it's being released, it's a little bit or none. Because of that now, the body has mismanagement in producing insulin. So the person is diabetic, they have too high blood sugars, way high sky level blood sugars, or sometimes too much insulin is being produced that causes high or low blood sugars. And as a result now, it causes a lot of frustration for the person. The person needs to take tablets, they need to take insulin in order to get the sugars well regulated. So sometimes it's due to high carbohydrates, that high diets of rice and macaroni, pizzas, all those carbohydrates, high food intake, increasing weight, not exercising. So much of these factors can influence the pancreas not being able to produce the necessary insulin, causing those problems to occur.
So it damages the kidney.
It damages the pancreas.
Okay.
And of course, due to the long-term effects now of that happening, it puts a strain on the kidney, because of course the kidney now have to work harder now to filter out all this glucose, all this sugar from the urine, and that can cause a lot of damage to the kidney as well. So persons who are diabetic tend to have problems with the kidney as well too. Even the medication that they take to control their blood sugars can have effect on the kidneys as well too.
It doesn't seem as if it's not everybody, it's not everybody.
Not everybody.
No, sis.
Some more than others.
Yes. Not everybody.
Yep.
Yeah.
Not everybody. Some more than the others.
Yeah, some people have it for over 30 years or more. And nothing wrong with their kidney.
Some people, they do very well. They are very well good managers of their body. The condition, the diabetes, they have a pressure. Whereas others, they feel, I'm taking medication so I can still eat and just behave, do bad habits, and that does more harm than good.
Yep.
Yep.
Because some people, as soon as they finish eat, they would take insulin. If they eat something that they're supposed to, they use insulin.
That's true. Some people, they use the insulin. Some people use the tablets, because the tablets work similar to the effects of the insulin, but the insulin that they take with a pen works more directly, because it's
through the blood.
Form. Yes. And whereas the tablets, it have to take a while before it's absorbed by the body. It have to be broken down. So that process takes longer than the insulin pen.
Wow.
That is why it's important for us to be aware of our body. That's why you have in this program today, early detection, early screening is very important. So as I mentioned earlier, the chest pains, the sudden chest pain, the severe headaches, the unexplained weight loss, the shortness of breath, the persistent tiredness, body weakness. If they notice blood in your urine, Sister Paulette, or blood in your stool, or when they coughing, they notice blood, that's something to pay attention to. Even they notice lumps or swelling in their body, they need to be mindful of that as well. All these things we have to pay attention to and not to take for granted.
And we also can check our glands, right? Those little glands on our neck, right? If it's swollen, right?
That's right. Yes.
Glands.
All those glands as well too is important. Mm-hmm. Unexplained lumps. You feel in your breast, you feel in your neck, you feel in your abdomen, or even by your hand or your legs, you notice swelling. That's not normal. That's things you need to check.
Yeah. A
If
girlfriend.
you notice that you're not going to the bathroom frequently, you notice you're not urinating frequently, or you're not having a bowel movement frequently, that's something you need to pay attention to.
Yeah.
People don't pay attention to those things until last minute.
Well, a lot of people suffer from that,
That's it.
Yeah.
That's it. But then the fear of going to hear the bad news, it goes back to what we were saying. The fear, the anxiety, the lack of time, not having the money. Some people don't have the money to go get checked. Some people really don't know. They don't know.
And work have a big factor to do it, Work have a big factor in our lives. Because sometimes we don't want to miss a day work. And so we always put on for tomorrow. I'm one of them too.
I tell you, that's a big factor. I hear it every day on the job.
Yeah.
Nurse, I don't have time. Nurse, I have to go. The boss is expecting me to come now.
Yeah.
And they don't stay.
Yeah.
They don't stay.
And
I will be honest with us, the wait time sometimes is a little long because, of course, when the doctor sees one patient, the patient talks their whole life story.
Yeah.
Because remember, the doctor has to build a rapport with them. He has to get a history of them. He can't just write a prescription and treat them. He needs to know what's going on with them. So that talking takes a little while. And of course, because of that now, it causes the wait time to be longer for some people. That's why we tell patients, we tell clients to go to your doctor often. You know why, Sister Pauline? Because if you go to your doctor today and you've been going to the doctor for, let's say, every 3 months or so, the doctor has an idea of who you are. He has a file, he has a history of you. He don't have to talk a whole year conversation with you because he knows you. He's acquainted with you. He knows your whole history. But when he only sees you once every 3 years, once every 5 years, he has to go through a whole database to get all the information about you, and that takes time. But once you have a familiar, frequent customer, frequent client, he knows you, and he can continue building that rapport and continue helping you manage your health.
Well, my dear, I have a folder with all my results from my doctor. My doctor, you better give me my result. You better give me my copy when you finish the way you're doing. Because when I change my doctor, I bring from 2009 until 2025. So he got to look through all. I have all my doctor results, them in a folder, year by year. I put them by the year.
Wonderful.
So when I change my doctor, I don't have no problem. Don't ask me the question because the results I have in front of you right there.
Wonderful.
I don't. When you come on to that, and meet a person like that. When I don't satisfy with you, I change in doctor. So I always have my result them on hand.
Nice. And we wish more people could be that organized as that.
Yes,
that's database, have your things organized, your health results and all those things. It's very good to do that.
Yes,
very good.
There and then when you change your doctor, you can see your past history.
Exactly.
Yeah.
Because that is important in moving forward.
Yes, very important.
Yeah.
Everything I have it year by year. Just ask me the year, which year you want, and I tell you. And I give it to you.
Wonderful.
Yeah.
Wonderful.
Yeah, that's how I do mine. So I wish everybody do the same.
We have the power in our hands, Sister Paulette. We do. We have total control over our health. And of course, God is with us. And we have to make that step every day to make those lifestyle choices. We know the lifestyle choices. Exercise. Eat right, eat a balanced diet, not just rice and chicken or rice and fish. We need to include our fruits and vegetables, our whole grains and so. For those persons who smoke and, consume alcohol, we got to limit those things or cut it out completely. If we want to live, quality life, we got to take charge of our health. Yeah. That is very important. And when the health screenings comes up, the health fairs come up, we should take advantage of those.
So why is it that pancreatic cancer is so delicate? It doesn't live long with
Mm.
pancreatic cancer. Why?
No, persons don't live long with pancreatic cancer because what happened is pancreatic cancer is a very rapid um, that diagnosis, a rapid condition. Due to the whole nature of the diagnosis, once that is detected, the person do not live long. I think between 2 to 3 months, the person dies. It's very rapid. It's very aggressive.
So short term?
It's very short.
Yeah.
Very. The two cancers that are very rapid that I have known in my practice is cervical cancer and pancreatic cancer. These two cancers, they attack the body and kills it very quickly.
Fast. Mm-hmm.
Mm-hmm.
Is it
Very,
because of
very,
the
very.
tissue is soft or something?
Sorry.
Is it because the tissue is soft or what?
Um, I, what I know is that usually that diagnosis when it's detected, when they notice you have pancreatic cancer, most people they most catch these at the late stage.
Yeah.
And where it's positioned to, where it's located, and all organs that is attached to it or is close by it gets affected immediately. Usually when a person recognizes that they have pancreatic cancer, it's usually at the last stage, and when it comes, it's just it metastasizes to all the other organs, and within a matter of seconds,
But what
the
are
person dies.
the signs? It give a late signs. What are the signs anyhow?
That's it. I don't have it here close to me because I don't want to give the wrong signs. And
Okay,
so,
okay. Because
yes,
it's on the late stage you will find out you have that because like early signs,
yes.
like breast
Because I
cancer.
was reading an article the other day, and I read they were sharing a scenario of this doctor that was feeling extremely tired and fatigued. He was very, weak. He had a lot of muscle weakness. He was very fatigued. He was very pale. He was cold, sweating, and so. And they just, decided to do. He was complaining some aching to the area too, to his rib cage there, and they decided to do a scan, and they noticed that he had pancreatic cancer stage 4.
Oh,
and it wasn't long before he died. The article was expressing how the signs that he had exhibited, and before long, it wasn't too long before they diagnosed it. It was like within 2 weeks he started complaining of these symptoms, and then when they did the scan, it was already stage 4. So as I said, sometimes the signs are not present. There's no symptoms, and then when the person do start complaining, it's already at a late stage already.
Yes, I heard that. I read that too.
Mm-hmm.
The signs,
Yes.
the signs. That's deadly.
Yeah. Yeah.
And cervical cancer is bleeding.
Yes. Some people notice a lot of bleeding.
Abnormal
sometimes,
bleeding.
Yes, they have abdominal pain as well too. Mm-hmm. Most of the time, it's a lot of bleeding and pain. That's why it's important for we women of childbearing age, even most women, start pap smear starting at age 21. Once you're sexually active or you had a child or so, it's important for you to do your pap smears. Yes, some of them doctor will tell you do it yearly, or they will tell you do it every 6 months or every 3 years. It all depends on what you find, your risk factors. If you have a risk factor of it in your family, you will do it more frequently. Just like breast cancer. Most people start doing their mammograms as early as 40. Some people are advised to do that as early as 50. But if you have a family history of breast cancer in your family, doctor will tell you to start doing your mammograms early. Because sometimes you never have any symptoms, you never have any complaints, but your family history gives us a strong idea of what can happen. So we start screening you early as possible.
So
even colon cancer and prostate cancer, we ask men as early as 50 to start doing your PSA, start doing your screenings, early. Some people start at 45, 40, but you start as early as possible.
So HPV, is that lead to cancer?
Mhm. HPV is known as human papilloma
Papillus.
virus, and it's, of course, it prevents when people take the HPV vaccine. I don't know if you heard about it. Most young people, they are admonished or advised to take the HPV vaccine, and that is because we want to prevent them from getting the cervical cancer. That's that's why when you do the pap smear, we look for the HPV virus. Yeah. So we look for that's why when you do the screening, they check to see if you have PAP 1 or PAP 2 or you have a PAP 3AB. It all depends. And they also look at the HPV virus to see if it's present. If it's present, then they will take measures in which they can treat it. But if you take the HPV vaccine, it's a higher chance in you not contracting this virus.
So you do that every 5 years or what?
The HPV vaccine?
No, the test.
The test, usually for women, we actually start for them to do it from age 21. And when they start, most doctors recommend every year. Or if you test when you do it every year, it's normal, then doctors say do it every 3 years, every 2 to 3 years. All depends on the risk factors. If you have no risk, then doctor might tell you do it every 3 years. Whereas for some, they might have to do it every 6 months, depending if there is an HPV virus present.
Yeah.
Or if the pap is bad, doctor will say let's repeat in 6 months and see what happens.
Yeah. So colon cancer, right?
Yes.
That lead from not going off very often. That develop colon cancer.
Right. So some people, they have a lot of digestive issues. The food is not being broken down properly, and as a result of that, they can end up having a lot of intestinal problems. What you notice happening to people who have colon cancer tend to not have a good regular bowel movement pattern. So you'll notice they're always constipated, or they have diarrhea, or you notice that the structure or the stool or its form is not formed in a good form.
Slim.
It's not formed properly.
Slim.
Sorry?
The stool will be slim.
Right. And what you notice happening too, when they do go to the toilet and they do have a bowel movement, they usually have blood in the stool.
Blood in the stool.
Yeah, or it's very painful. When they go to defecate and they go to stool, it's very painful for them. Or if they eat something, it takes a very long time for them to go to the toilet, or they have a lot of stomach problems. You notice they have a lot of cramping after they eat. And these are already signs. You notice they're losing a lot of weight. They're not able to digest stuff. They're not having a good regular bowel movement. That's already cause for concern. That is why it's important for us to do our colonoscopy. Do all those things to make sure that, our digestive tract and everything is clear from those conditions.
But diverticulosis, so pronounce it diverticulosis, but that's similar to
yes, diverticulosis.
That's something inside the colon.
Yes.
But that causes colon cancer?
Yes, it can cause cancer as well too. Yes, it can cause cancer as well too.
So those two can cause cancer.
Yes.
Irregular movement and
there is irritable bowel syndrome, diverticulosis. All those things can lead, to these conditions later in life. Yeah.
But the diverticulosis can be cured?
Yes, it can be. They have treatment options that can be, depending on how far the diagnosis is. Sometimes it's minor and they can reverse it, or they can treat it with medication, or they can do surgical intervention to repair or to treat the bacteria or whatever is causing the problem. But if the intestines has a problem, it may need repairs.
Yeah.
It all depends on when you catch it too.
It's more difficult.
Early detection. If you don't catch it in time, you cannot treat it effectively. Yeah.
Because your colon delicate too now.
Sorry?
Your colon is very delicate as well,
Very, very
because
delicate.
that's
Very, very
true. Yeah,
delicate. Hmm.
that's true.
That's why we have to be so careful with what we eat. You know, the foods that we eat, we make sure that when we prepare our foods, that we wash out our vegetables or fruits properly. Because when we don't wash those things properly, we are actually allowing those things to come in, those bacteria, and so
Bacteria.
that can mess up with our, intestines, our small and large intestines. Remember, our small and large intestine, our stomach already has bacteria. We call it the good
The
flora,
good
the good
one and
flora,
bad.
the good bacteria. But when we ingest those other foods, those foods that are not cooked properly, the chicken, the steak, the ribs, the pork, and all those things, and we put those things in our body, it can cause difficulty in our food being broken down in the body, and those things can stay there and cause scarring on the inside of our stomach, our intestines. It can scar our tissues, scar our intestines, and it can cause major problems for us later on. So we have to
Mm.
be very careful of how we prepare and how we chew and how we digest our food.
Well, well. It's good to know. It's good to know about our bodies for real. Trust me.
Yes,
There's
yes.
so much things to
So
look
much
for
to
in
be
our bodies,
granted.
right?
That's true.
There's
God
so
has given us this beautiful temple and we have to take care of it. It's
yeah, so
good that
many
we can get up in
things.
the morning and go to work, but we got to take care of our bodies. We have to
Mhm.
pay attention to it. We have the power in our hands. Early detection, early detection has proven that treatment options are easier to treat.
Okay.
Yeah.
Okay.
Earlier the disease is found, the easier it is often to treat.
Okay.
Yeah.
It's it's
So we have to
it's
take control of our health and listen to our bodies.
you can have the last word now. It's almost an hour, 4 minutes to an hour. So you can close
Oh
off
wow,
for next time.
the time has definitely flown by.
Yes, when something
And
is
I'm so
interested, that's what
grateful.
happens.
I tell you, and I'm so grateful for being here this evening to educate the population on how important it is for us to protect our health. Before it's too late. It's very important for us to take charge of that. And God has blessed us with a beautiful body. And it is our responsibility to take care of what God would have given to us.
Not
So I'm so grateful for being on your show. I'm so grateful for being here and being able to talk about something that impacts all of us and how we can take care of our health. Yes, I hope that all that we would have discussed today, what is early detection, the warning signs, how we can go about preventing our health, what are the factors that causes us not to go there and to do the screening, but to take charge of our health and go there and be an example so that others can follow. And I'm
can
so
follow.
happy that you are practicing what you preach and taking control of your health and doing what is necessary.
I want to live. I want to live. I want to live. I want to live as long as ever.
Oh yes, indeed, indeed.
I know. I know. I know. I'm not going to live to see 60 more years. I know, but I want to live as long as ever.
Amen. Amen. I think that's the desire of all of us in the world. But are we really doing what we are able to do so that we can live that long life?
I know. I don't eat meat. I don't eat processed food. I don't eat canned stuff. I don't eat a lot of things. I don't drink sodas. I try my best not to do those things.
You see?
So I try.
Yeah.
Maybe that's why I look so young at 60.
I tell you, indeed you do. For sure.
Anyway, it's nice having you. I don't know if we'll find the time again to do something else.
We definitely will find the time. Maybe we can try, but we'll talk about it.
Yeah.
Yes. See how often we can do it. Thank you so very much again.
Thanks for coming.
God bless you.
Thanks for taking the invitation. And tell your husband he's next.
I definitely will let him know. He's getting ready for you.
I know. I know. Have a good night.
Yes.
Bye.
Take care. Thank you again.
Bye.
Bye.
Bye. Yes. I hope we're informed, educated about our bodies. Because our body is a gem, eh? Our bodies are a gem. That's something we're supposed to appreciate, love. All of us love ourselves. Or some people don't love themselves because they don't love how God made them. They change. They put on false whatever. They change their nose, they change their mouth, they change their bottom. So some of them don't like themselves. Sometimes in the morning you see those bottom roly poly going up exercising their bottom, but when they reach my age, they're gonna wish the bottom was like how God make it. Mhm. Yes, those false bottom and all that kind of things, people changing up themselves. Later on, they're gonna have an effect on them. For sure, they're gonna have an effect. Yes, gonna have an effect on them. So it was nice being here, and thank you for watching. And I'll see you tomorrow. Share, comment, subscribe, and share the good news. I'll see you. Bye.